Good evening, friends. Meeting after a gap of 2-3 days. We'll start with today's session. Just a short revision regarding the mental diseases we'll do, and first variety of mental disease we'll do, and then we'll go ahead. So we have started with the aphorism number 210, where he starts explaining about the mental diseases. And he starts with one thing, that as you treat any chronic disease, any one-sided disease, in the similar manner, you treat the mental disease. Because when you take into consideration the mental aspect, the state of disposition of and mind during the physical disorders, when dealing with the mental disorders, you have to take into consideration the same thing along with the physical generations. So both things are vice versa, one and same, and that's why they are not two different parts, but they are unique, and that's why you have to take into consideration the holistic aspect of the human life, and accordingly you have to look towards the mental diseases. But for the sake of treating the mental disorders, how one should approach? And for that purpose, it is too much necessary to differentiate the mental diseases. Hahnemann was the first one who classified mental diseases into 4 types. The first variety, which he has explained over there in detail, is the variety where the corporeal symptoms disappeared because of allopathic medicines, or they are suppressed. And when they get suppressed, the disease changes to a higher plane, that is the dynamic plane, expressing at the level of dynamics, at the level of mind, and mental disorder starts. And such a disorder is definitely because of suppression, is always used to produce a harmful disorder for the human being. Many patients who comes to you with such types of disorders have a mental pathology. Mental pathology in the sense that they are suffering from obsessive compulsive disorder. They suffer from paranoid schizophrenia. They suffer from depression. They suffer from anxiety neurosis. Such disorders, which are labeled in psychiatry as a difficult disorders to treat, are always the variety of first type of mental disease. As on that day, the Nisha has said that, "Oh, sir, you must share the cases." Yes, I want to share one case. He was one of the my patient who used to stay nearby my clinic, and he was diagnosed as a case of paranoid schizophrenia, and it was he was taking allopathic treatment since long time, nearly about 15 years before coming to me. Before that, he had an epilepsy, and his epilepsy was under control with the help of anti-epileptics before that 10 years. He was nearly about 40 years of age person, and came to me with this paranoid schizophrenic trait, and along with he was having epilepsy suppressed with the treated with allopathic medicines, and those medicines were going on even for 20 years. The anti-convulsions were going on. As soon as he stops taking the medicine, he used to get the epileptic attack. And before that, before getting an epilepsy, he had a severe skin eruption. After skin eruptions getting suppressed, he developed epilepsy, and after epilepsy gets suppressed, he started getting these paranoid states. He becomes too suspicious. Whenever anyone looks towards him, he used to feel that they were looking at him always. He used to find it out the fault with each and everyone. He was not able to communicate properly. That was his problem during the paranoid state, and he becomes so suspicious that each and every member from the family on whom he was very suspicious. He used to look toward them with suspicious eyes. He used to ask everyone, why do you went to there, why do you went there, why do you remain in that room? Every time, every moment, he used to ask such types of questions on each and every member on the family, regarding his father, regarding his mother, regarding his sister, even his brother. And it was rather difficult for them to handle that fellow inside in the house. Because being a elder, they cannot do anything. That was the problem. 40 years of age, it's rather difficult to handle such a person at home. So he was brought to me with such a future, and we took detailed case. He discussed each and everything, but when he was looking towards me, his eyes were quite suspicious. He was doubtful that whether I'm writing over there. That much suspiciousness was there. And then he told his whole story, and where this was explained that convulsions after convulsions he developed that specific paranoid state, and he said that yes, these are the medicines which are going on, and there were a lot of allopathic medicines for the paranoid schizophrenia, those were going on, and he used to sleep day and night. Whenever he used to consume that tablet, he used to get sleep, and that's why he becomes so obese. His weight was nearly about 97 kg at that time. So it was it was very high. And this was the result of those anticonvulsant tablets as well as antidepressant tablets. All those, the result always goes into depression, always goes to build up obesity. At the same time, the person becomes absolutely drowsy, dull, dizzy. So all those things were there. So after whole case taking and depending upon the totality, that there was a totality, all this already he has mentioned, there were typical things that he had the dreams of snakes. Then in childhood, he used to suffer from epistaxis during the summer season. So remedy was very clear in my mind was the lachesis. So I have given him lachesis. Lachesis, yes, in such types of cases, what potency one should give. When you get such a pathological mental disease, this is a pathological mental disease, you should not give too high. Otherwise, sometimes you might get an aggravation in such type of case. So I have started with him like a LM11 directly, daily one dose. LM was mild potency. LM is a mild potency which never causes too much trouble. It never aggravates. And after starting the Lachesis LM, after a span of 1 month, when he came, he was little bit better. He was happy. At least his drowsy state was disappeared. And he was happy. He was reacting very nice way. He said that doctor, I'm feeling much better. Then I have continued LM11, LM12, LM13. And gradually I started decreasing the dose of his anticonvulsant, psychiatric treatment, that the medicines which were going on for paranoid state. Very gradually I have tapered that. Thereafter, one day he got the convulsion. He was having medical shop, and one day in the shop only he got the convulsion. But he was, after 10-15 minutes, he was quite awake, and then I saw him over there. Then I shifted the remedy from lachesis to ginkgo med on his futures. And after ginkgo med, he was so nicely recovered that his convulsion stopped. I have followed him nearly about 2-3 years. We have reduced his anticonvulsants also gradually. And he came out at the same time, he developed a rash all over the body, which persists nearly about 2-3 months, but they were ready to maintain that. And very later stage, that rash disappeared. It took nearly about 2 years to come out of that situation. But it was a wonderful case for me. A case of paranoid schizophrenia with suppressed convulsion, before that suppressed skin eruption. It was a whole case. So such cases you might get in your practice. You must take into consideration holistic approach and find it out your own remedy. So we have discussed about this homeopathic management of post-type mental diseases, where Hahnemann says that psychotherapy never plays so much of role. That he explains in mental regimen that we'll learn later on. Let's start with the next aphorism, that is the aphorism number 221, where he starts with the second type of mental disease. If, however, insanity or mania caused by fright, vexation, the abuse of spirituous liquors, etc., have suddenly broken out as an acute disease in patients' ordinary calm state. Although it almost always arises from internal sora, like a flame bursting forth from it. Yet when it occurs in this acute manner, it should not be immediately treated with antisorics, but the first place with the remedies indicated for it out of the other class of broad medicaments. Example, aconite, the belladonna, the stramonium, the hyoscyamus, the mercury, etc., in higher potentized, minute homeopathic doses in order to subdue it so far that the sora shall for time revert to its former latent state, wherein the patient appears as if quite well. See, this is the second variety of mental disease which he tries to explain. These are the acute manifestation at the level of mind, the mental explosion because of some exciting cause. It might be a sudden fright. It might be because of the some abuse of serious or which are called as spirituous liquors or alcohol or some drugs. Sometimes it might be a quarrel with someone, and patient goes into acute insanity. Patient might show hysterical reaction. Patient might show a very frightened reaction. Patient might immediately collapse or show facial expressions as if weird facial expression, and that violence might be an acute violence. All those manifestations, they are created because of exciting cause. Yes, definitely background is sora, background is miasm, but miasm was in a latent state, it was hidden. Some exciting cause which has developed, and because of that exciting cause there is a violent explosion of that emotional state which comes out, to which Hahnemann says this is an acute manifestation of the soul. If it is so, you have to match the pace of the disorder with the pace of the remedy. Here, your deep acting antisoric will not going to control that patient. If you want to treat that patient, you have to find it out a remedy which has that pace. And that's why he has given the examples of aconite, the belladonna, the hyoscyamus, the ignatia, valeriana, which has acute pace, which works, stramonium, very fast acting, acutely acting remedy. So in acute state of mental disorders or acute manifestations of mental disorders caused because of exciting cause, you should always give an acute remedy. You have to match the pace. It is not a disease which happens gradually. First variety of mental disease, it takes a long period to develop. And that's why there is a gradual increase of the symptoms, and then disorder reaches at the peak. In the second variety, it is haphazard. It goes up directly. It is because of sudden exciting cause. And that in such a condition, he says you have to match a remedy which is acute in reaction and which matches at the symptomatic level. So this is the second variety or second type of mental disease. Then he explains few more things about this second, how to handle those cases. So he explains in the 222 aphorism what he exactly want to explain over there. But such a patient who has recovered from an acute mental emotional state disease by use of these non-antisoric medicines, underline what is a non-antisoric. So those remedies are non-antisoric, they are not deep acting, they are the remedies which are acutely acting, should never be regarded as cured. So you should not consider now patient is cured, you have given aconite, patient is settled and patient is cured. No, patient is not completely cured. You have removed the state, you have cured the state, but disease is prior, disease is in the Maya, disease is manifestation of the soul. And that's why he explains that unless and until you recover that sora, it is not possible to get the cure. On the contrary, no time should be lost in attempting to free him from completely. So you should not wait for some time that patient will again come and then you'll give the remedy. Once the patient is settled, don't lose the time. By means of prolonged antisoric treatment from the chronic miasm sora, which it is true has now become once more latent, but it's quite ready to break out anew. If this be done, there is no fear of another similar attack. If he attend faithfully to the diet and regimen prescribed for him. See, very, very particular about the feedback. He was very particular. Hahnemannian thought was very particular. He used to never say everywhere that just give this remedy and treat. Many homeopaths do that. They never think about the homeopathic management. Homeopathic management is always a defined management. Your mind should work in a systematic way. So one should think what should be your auxiliary measure, what should be your constitutional remedy, what should be your acute remedy, how to tackle each and every variety of disease, how to differentiate the disorder, so that accordingly you can think about the all those things. So he was very particular. In first case, he has said there is need to give directly an antisoric remedy, no acute remedy will work. But second variety of the mental diseases, he says that there is need of giving the acute remedy, which is non-antisoric. Handle that state at in acute level or at acute level, and immediately when it settles, the background miasm should be treated with the antisoric remedy. See, this plan of the treatment is very clear. And he says that is not only sufficient. What he says, there should be, the patient should follow diet and daily regimen properly. That is very important thing. Diet and regimen which is prescribed, should be followed clearly. Then patient will be cured forever. Why he is saying that? Because these are the important entities of the human life. If you don't follow the diet and regimen, definitely you will going to land into some disorder. There was one patient who was brought to me with the myocardial infarction, who had bypass done 3 times, and he was fourth time came with chest complaint, and again advised that he has to go for bypass. They said, how can it be not possible to do now? And that's why he came for the homeopathic treatment. He was short statured and his weight was 86 kg. And when I asked, what is your daily regimen? At what time do you wake? He told me that at 1 o'clock I used to wake up. I asked which one, midnight or midday? He said midday. Then I asked, at what time do you sleep? He said, I used to sleep at 3 o'clock at night. Then I asked, what is further regime? What is further daily routine? He said that when I wake up at 1 o'clock, then I do some breakfast at 2 o'clock, and then at 5 o'clock I take lunch. Then again I take rest for another 1 hour, and then I go to my hotel, and there I used to stay. Then I do again some breakfast. I used to take dinner at 1 o'clock at night. I said that even Brahmadeva come, you will not going to get cured. Because that is the problem. How can he be? Nothing can be done in such types of cases. I asked him, if you want to survive, only one thing, you have to change all those things. He said, how can it be? My hotel is there. What will happen if you will not be there? What about the hotel? I asked, that is the only question. Then he said, yes, whatever you said is correct. Then I said, what I used to tell you, follow it. It is possible to come out of this situation only when you change your daily routine. And he agreed. He followed each and everything. He reduced 15 kg of weight. He came to 70 and nearly survived for 12 years after that. So this is very important. Diet and regimen plays very vital role. You should be strict enough to tell the patient. But when you tell the patient, you should follow it. That is most important thing. You have rights to tell when you follow it. If you don't follow it, don't tell anyone. When you said you do the exercises, and if you don't do it, don't tell anyone to do the exercises. But for that purpose, diet and regimen, understand that properly. Understand diet regimen, how to maintain that, how to maintain healthy diet. All those things are very much necessary. And then you go on telling them. That plays very vital role. And that's why I used to teach this part in my clinic, that homeopathic management, it is not only just giving a remedy. I used to spend much time with the patient. I explain each and everything. I explain many things to them, in fact, because there were many wrong concepts in people's minds, and that's why it is too much necessary to you must know all diet and regimen plans and how to tell with every variety of cases, and then accordingly patient can work. There is one footnote to this paragraph, and that footnote is very important. Footnote is related with same thing. What he says is very clear, and his concepts were very clear. Footnote number, I think, 123. It very rarely happens that a mental or emotional disease of long-standing ceases spontaneously. For the internal dyscrasia transfers itself again to the grosser corporeal organs. Such are the few cases met with now and then, where former inmate म्हणजे आत राहणारा, which resides inside, where a former inmate of the madhouse has been dismissed, apparently recovered. He says that there are madhouses, वेडांचे पितळ आहे, and once a patient went over there, he never comes out live. Hitreto, moreover, all madhouses have continued to be chock full. Madhouses वेडांचे पितळ, chock full म्हणजे full, तिथं जागाच नाही कुठले. Houseful, chock full, houseful. So that multitude of other insane persons who seek for admission into such institutions could scarcely find room in them, unless some of the insane in the house died. Unless and until one person in the madhouses died, it is not possible to have entry over there. They are full. Not one is ever really and permanently curing them. He says that not a single patient who used to stay over there gets cured. Because it is not possible to cure such patients. A convincing proof, among many others, of complete nullity of non-healing art, iterative practice. He criticizes directly non-healing art. Non-healing art is short note for the students who are exam going. Non-healing art is nothing but the word which is used for allopathy. Hahnemann have criticized allopathy with non-healing art. A convincing proof, among many others, of the complete nullity of non-healing art, iterative practice, iterative म्हणजे आतापर्यंत, which has been ridiculous म्हणजे हास्यास्पदपणे, which has been ridiculously honored by the allopathic ostentation म्हणजे दिखाऊपणा, प्रदर्शन, which has been ridiculously honored by the allopathic ostentation with title of rational medicine. त्यालाच rational medicine म्हणून म्हणत होते इतके दिवस, which never used to cure any variety of disease. It never used to cure any patient. So that's why he criticized over there. He criticized directly as a non-healing art. How often, on the other hand, has not the true healing art, genuine, pure homeopathy, been able to restore such unfortunate beings to the possession of their natural mental and corporeal health, and to give them back again to their delighted friends and to the world? See, he compares homeopathy work with allopathy at that level, and he says that when you treat such types of disorders, just with finding a remedy on the basis of totality of symptoms, the state of disposition, finding it out right simillimum, telling him proper diet and regimen, and giving him that remedy, you bring that patient into normal again into the normal healthy life. where he can enjoy each and every moment of his life with the rest of the people. And this is unique. You don't have to admit him in the madhouses. No need. Give a right remedy and then it definitely works. But question of right remedy is very important. To find it out the right remedy, right simile, then it definitely works. So this is second variety of mental disease. Along with he is explaining diet and regimen plus acute remedy followed by deep antisoric remedy. So how to manage the second variety of disorder? Just keep it in your mind. Diet and regimen followed by acute remedy, acute remedy for the present state of disposition and mind, and followed by antisoric remedy to complete cure. So this is the homeopathic management of second variety of mental disease. One more paragraph is still remaining regarding the antisoric remedy, but that we'll discuss in tomorrow's session, and tomorrow we'll start with the third variety of mental disease. Both things will finish in tomorrow's session. So that's all for today. Thank you very much being there. Any queries there we'll have, otherwise we'll conclude. Any question?
Yes, sir. Hello.
Yes.
Sir, please guide how to do counseling in such cases
We'll
if needed.
take that session completely when diet and regimen comes. There is a big
Okay, sir.
topic given by Hahnemann at the end of concluding part of these mental diseases. We're going to do that definitely. So that's all for today. Thanks a lot, and we'll meet again tomorrow at the same time. Ask your friends to join. This is Organon, which is very important even from exam point of view. Tell them that to join the sessions. Okay? Thanks a lot. We'll meet tomorrow at same time.